questions, either about the model, about the experiences that have been shared here today so far. We're going to have time for discussion later, or if you do have questions, and you can also, of course, after the briefing connect as well, but feel free to.
I'm Shelby Hickman. I recently entered the academic world again after a while. I'm a PhD student at the University of Maryland studying criminology, but for the past 5 years, I was a research scientist at a nonpartisan group called Child Trans. And before that, I implemented kind of HIV and pregnancy prevention programs here in the DC schools. So I've been around in DC for a while, kind of new to the research world, relatively speaking. But for me, this experience to talk about current policy issues and how they align or didn't align with the research that I was involved in was incredibly valuable. In part, I was thrilled to talk to other people who were as excited as I was about the research I was doing, but the other part of it is that even the best meaning researchers who really want to translate their research, I don't think that they think the same way that staffers do, for example. So it was really eye-opening to have this dialogue and think about the things that I placed a high value on as a researcher, and then to hear, okay, the people who are going to consume this, what do they value? And am I considering that when I think about my methods, my data, and everything, and then how I disseminate the results? So as an example, I was talking about some research, and we were using nationally representative data. And to me, I was like, this is the holy grail, this is great. And what I heard pretty consistently was actually county level, state level, like bring it down for us. We don't need to know about the whole country all at once. So that was kind of one thing that I heard pretty frequently. And then the other thing, and they kind of touched on this earlier, is that we prepared, we had an agenda. I was like, I'm going to talk about these projects. And the conversation really just led us in different directions pretty naturally. And it was great to be with a group of really experienced researchers who were able to brainstorm and think about, okay, this isn't what I thought we were talking about today, but what research have we done before? I thought about research I did 5 years ago that I had almost completely forgotten about. And that led to one of my main takeaways from this experience, which is that, again, even well-meaning researchers who are trying to disseminate research, a research project ends, and then we immediately have new work to fill its place. And so if the alignment doesn't happen between when we're communicating research and trying to push it out and when there's a policy need for it, a lot of the time that evidence base will go unnoticed. And so we need to think about ways, I think, to continue integrating research into a dialogue that doesn't end. Another thing that I learned from this conference, I learned a lot from this entire experience, and I thought it was really eye-opening. But it challenged my outlook on research. A lot of the time, research doesn't reach program practitioners or policymakers or staffers until really we've got polished results, maybe we made an infographic, got everything done. But at that point, it's too late to change from nationally representative data to local data. Like, it's too late in the process. I think that the more frequent and the more ongoing and iterative these conversations are, the more relevant and helpful our research can be across fields. And so now that I'm in the academic world again, I haven't been in school for a few years, I am reminded that you're not in an applied research setting. There's not a lot of value placed on translational research. There's not any encouragement. No one's asking the questions except me, like the new student. How are we going to get this research to people who need it? So I had someone tell me directly, that's not how you advance your career. Because there is still a way of thinking that is, if you want to be prestigious, you need to publish in these 4 journals in our field, and you need to focus all of your efforts on that. But I don't think anyone but us is reading those journals. So I think it's really helpful to have these conversations and kind of think about how we can make this an iterative process and to maybe change cultures on the research side.
My name is Kimbrough-Melton, and I'm on the faculty of the University of Colorado, the Colorado School of Public Health, and I live in Central Virginia. And so you might ask, how can I teach in Colorado and be in Virginia? But technology is wonderful. So I had an opportunity to be one of the researchers involved in this initial pilot project. And when I became aware of what NPSC was doing, I just jumped at the possibility of being engaged in this. And one of the reasons why I did is because I've sat where you're sitting. I've been a legislative staffer, both at the federal level and with 2 different state legislatures. And so when I was a legislative staffer, the last thing that I had time to think about doing was reach out to my local researchers, my academics. Even though the university may have been just right across the street, it takes time to track down somebody and find somebody who's working in your field. It takes effort to engage them in what you're doing. Several people have mentioned here already that academics don't necessarily get reinforced for doing policy work. We have different kinds of incentives. As Shelby just said, we are evaluated on whether we are conducting research, publishing that research, and generating knowledge. Nobody cares really very much, and that's really a little bit of an overstatement. But we're not rewarded for pushing our research into the policy arena. On the other hand, if I'm working on human trafficking or juvenile justice or child abuse and neglect, I want to know that what I'm doing is going to have policy relevance and that it's going to be used in the field and that I can make a difference. And so when I was a legislative staffer years and years ago, it was not easy for me to reach out to researchers and to engage them in the process. On the one hand, I had a lot that I had to do. I had a lot of information that I needed to synthesize very quickly. The priorities were always changing. My bosses were engaged in a lot of different issues. And, you know, I really sort of changed my approach one day when my boss came to me, and she was a senator on the Appropriations Committee, and she said, why is it that we spend so much money on children's issues in this state, and we're getting such lousy outcomes? So I want you to find out why that's happening. Well, that's kind of a daunting task, and so I set out to try and figure out what's going on in children's services in our state, and how can we begin to improve the investment that we were making in children's services. And so I came to the conclusion that we needed to draft legislation that would have significant impact on the children's service system and begin to reform the service system. And so on the one hand, as we're embarking down this path, I've got a senator who's saying to me, how is this going to make a difference? I want to know how this is going to affect Johnny in this community. Or I want to know how this is going to affect Susie in this community. On the other hand, I've got advocates who are saying to me, you know, this is the best program since sliced bread. We need to fund this. We need to continue to move in this direction. Please don't change what you're doing because this is really working. Senator who's saying, no, it's not working. So what are we going to do? Well, fortunately, when I was engaged in this process, I had some researchers who reached out to me and said, you know, we really would like to be a part of this experience of trying to reform our children's services system. And so I said, fine. My senator was fine with it. She said the only caveat that she had was that I had to talk to them because she didn't understand what they were saying. And so she just wanted to make sure that I was doing the interaction with them. But that was okay with me. What I found in engaging with the researchers was that they were able to sit down and help me think about the right questions to ask. So they had the knowledge, they had the background, they knew what the literature was. If I wanted to focus on trying to improve the mental health system, they could talk to me about the kinds of things that I needed to think about in doing that, and they could point me to literature. What that did for me was that it gave me expertise very quickly. It gave me, probably, I would hope that we drafted better legislation as a result of it. But it also gave me, to be quite blunt, some cover, so that I could say to the advocates, look, this is evidence-based. This is the direction that we're moving, and this is why we're moving in this direction. And so let's get on board. This train's leaving. Let's get on board. Let's figure out how we're going to change the system. And so, So it was really a win-win situation on both sides. For the academics, it was an opportunity for them to engage with us, and actually they got a lot of journal articles out of it, and were able to still fulfill the needs that they had to meet the obligations that they had as academics. For us, I think we got better legislation. We were able to move the advocacy community in the direction that we wanted to go in. We were able to listen to people who were willing to talk to us without taking sides, who were willing to just lay it out and say, this is what the literature says. And then we could draw the conclusions, as opposed to somebody coming to us and saying, well, this is what you need to do, or this is what I think is best. And so I think that perspective as legislative staff is really, really important, and something that's not always easy for us to access. Now, as a researcher, I'm now in an academic position. In between doing legislative work and going into academia, I've worked in several professional membership organizations here in Washington. I'm the executive officer of a membership organization right now. So I realize also that with membership organizations, we do a lot of good work, and we hope that people will pay attention to the work that we do, but we also have a perspective. We want people to pay attention to prevention of mental health needs, which my current organization focuses on. So, you know, I think that there's opportunities for everyone to play a role, but I think the nice thing about a coalition like this, and certainly from the standpoint of somebody who's in an academic setting right now, is that it gives us an opportunity to be policy relevant. It gives us an opportunity to know that we're having an impact and that we can help you. It gives you an opportunity to take advantage of the expertise that we have. One of the nice things about this kind of a coalition is that they've done it for you. They have found the experts. And so you don't need to do that. All you need to do is call Taylor or Jackie and say, look, this is the issue that we're grappling with. This is what we need some information on. Help us think about this issue. The other thing that they've done is, you know, for me, as the executive officer of a membership organization that has psychologists and physicians and psychiatrists and social workers and lawyers as part of my organization, is that I have this whole network across the country of both practitioners and academics who are doing this work. And so by partnering with MPSC, they've been able to, in fact, access that network. If they come to me and say, well, we really need to have somebody that's an expert on prevention of mental health around this issue, chances are we can find that person. And so it just sort of expands the opportunities to bring knowledge into this setting to help you ask questions that may be important to your bosses, and to do so in a way that, you know, we're not trying to push you in a particular direction, but just trying to help inform what the literature is. So thank you.